Right. So my whole career, I've been really interested in exercise, and I've been interested in how exercise perturbs metabolism and leads to, you could say, growth and strength and performance. And so I came from the field of exercise physiology. And I got interested in how exercise could be useful in people with diabetes from my mentor, John Halazzi. And at the time, there was a lot of interest in using exercise to help people recover from cardiovascular surgery. And there was also an understanding that exercise had a blood glucose lowering effect in people with diabetes. And so I was really, really interested in trying to understand where some of the defects were in insulin resistance. So for people who have diabetes, why do they have diabetes? Why do they have insulin resistance? And I was really interested in how exercise could mitigate or prevent some of the effects of diabetes. So I was interested in how exercise could lead to metabolic changes in muscle and bypass some of the insulin resistance. When we think about exercise, there's a lot of different kinds of exercise. So there is endurance exercise and there's strength training. If we just look at just those two different modalities, they each lead to different changes in working muscle. And with endurance exercise, there's a boosting of the ability of muscle to oxidize fats, and there's an upregulation of genes that are related to the mitochondrial, which is the powerhouse of the cells. And so endurance exercise really does promote metabolic changes and lead to greater oxidation. Resistance training, of course, leads to strength and power. And that's very important if you think about the aging population, because as we age, we often lose strength and muscle mass. And so the idea here is that if an individual performs regular exercise, through endurance training, they can improve their oxygen consumption and their oxygen consumption rates, and they can improve their metabolism. And through strength training, they can improve their capacity. You know, they can preserve muscle mass with aging. And all of those things together are good for people in general, but they're particularly good for people who have obesity or type 2 diabetes, because it is a way to make the muscle more sensitive to the hormone insulin. And in this case, individuals may require less insulin or fewer medications to manage their blood glucose levels. And so it's an important part of anyone's therapeutic regime to maintain endurance and